Good evening. The Prime Minister says the UK is for the most part proceeding as one on implementing coronavirus travel restrictions, despite the home nations now disagreeing on quarantine rules for those coming to the UK from certain countries. From today, there are different regulations for people returning from Portugal and Greece, depending on whether their final destination is Scotland or Wales or England and Northern Ireland. The Transport Secretary, Shapps, says he admits the varying approach is confusing. Our Europe Correspondent Gavin Lee reports now from southern Portugal.
Back to Britain from Faro Airport this morning. Where you're going back to now dictates whether you have to self-isolate.
There's been no clarity from the government as to what we were doing.
Karen and Mick are heading to Birmingham. They don't need to quarantine, but they bought early tickets home because they thought they did.
Obviously not very happy. We feel as though we've lost 2 days of our holiday. It's cost us an arm and a leg, and we're just very disappointed.
As more and more British tourists return home, it's clear to me how confusing many people find the new rules. For example, if you're an English traveller flying to Cardiff today, you can then drive back, won't have to self-isolate. But if you're Welsh and say land at Birmingham today, you'll then go back and have to spend the next 2 weeks in isolation. And this new way of travelling has just become even more complicated. So just how do the UK nations differ on quarantine? If you live in Scotland and are returning from Portugal or Greece, you have to self-isolate for 14 days. For Portugal, that will kick in at 4 a.m. tomorrow. If you're arriving back in Wales from Portugal, self-isolation started today. But from Greece, the Welsh Government only requires you to quarantine if you're coming from specific islands. In England and Northern Ireland, there are no restrictions. Portugal has seen a rise in coronavirus cases in recent days, going just above the UK's margin of safety of 20 cases per 100,000 people. But the tourist destinations of the Algarve aren't the problem. So why are politicians taking such different approaches?
We look at the data and then we do speak, but I'm afraid quite often coming to slightly different outcomes.
Hugs and relief at Glasgow Airport this afternoon as travellers made it back before their isolation deadline. But few are smiling about the decision here.
We had to change our flight. We were just disappointed that Scotland obviously have to quarantine, but England don't.
It was a risk. We knew that we were making a risk anyway, so we only lost a day. It is annoying, but I'm just glad we made it home in time.
It's estimated that more than 30,000 UK holidaymakers have headed out here since the travel corridor opened 2 weeks ago. Golf and good weather, a magnet for older travellers for so-called silver season. On the streets of Faro, the usual rhythm of the night is quieter. The attraction of a late summer break here may have lost some of its allure. With fewer British arrivals today, the risks and unpredictability of travelling to these shores is perhaps too much of a gamble. And tour operators have told us that they've cancelled 4,000 hotel bookings this week because of the uncertainty with UK holidaymakers cancelling their autumn plans. And one Portuguese government official has messaged me this evening to say they frankly find it flummoxing. They've said that Britain has, well, some areas find Portugal no-go, other areas say it is safe to be here. And it matters because Brits form the backbone of the tourism economy. Their absence hits hard.
OK, Gavin, thank you. Gavin Lee there in southern Portugal. Now, the latest government figures show there were 1,940 new confirmed coronavirus cases reported across the UK in the latest 24-hour period. Now, that means the average number of new cases reported per day in the last week was 1,530. 10 deaths were also reported of people who died within 28 days of a positive COVID-19 test. That means, on average, in the past week, 7 deaths were announced every day, taking the total number across the UK to 41,537. And people in Leeds are among those being warned they're now on a watch list of coronavirus hotspots after a rise in the number of cases. Several other areas in England have also been added, but in some places restrictions are being eased, allowing swimming pools, gyms and sports facilities to reopen. Luton is enjoying a fall in infection rates following the implementation of a local action plan, as our health editor Hugh Pym explains.
Another city and another new challenge in the bid to control the virus. This time Leeds is facing increasing case numbers, said by the council to be broadly spread and many amongst younger adults.
It's premature to talk about lockdowns at this stage, but clearly if it's felt that there does need to be restrictions of movement, for example, then that is something, of course, that we will have to put into place.
Local people we spoke to agreed there was a need for caution.
I know that if it was my grandparents at risk, I'd want us to go into another lockdown to save them.
Limiting when we go out, to only going out when we really have to. You just got to, like you said, you just got to be responsible and just not be stupid, really.
As well as Leeds, several other places have now been put on the Public Health England watch list. South Tyneside, Middlesbrough, Rossendale, Corby, Kettering and Norfolk have all seen an increase in cases. But other places where infections are down have been removed: Wakefield, Newark and Sherwood and Slough. In Luton, extra restrictions were imposed after a rise in case numbers, but they were relaxed last month after action by the local council. This included intensive testing of people without symptoms to locate problem areas.
We have seen a lot of asymptomatic spread, so a lot of people who don't have symptoms being tested positive, and that's helped us track those outbreaks and work out how we can try and stop them before they become a wider cluster.
But she told me that recent testing capacity problems had affected their efforts.
We are asking just for the next week or so for people only with symptoms to be tested in Luton to make sure that we have enough capacity. It is proving to be a challenge for us, as it is for other areas.
There is a sense here in Luton that things are moving in the right direction with tackling the virus, but civic leaders know that could change, and they don't want local people to drop their guard on safety and social distancing. Some I talked to don't want further easing.
I think we're all aware about the measures that they're taking to boost the economy. It's the point at which should there be a higher focus on public health still before the economy.
And a lot of people are just feeling like it's all gone back to normal now as well. So not many people are actually using the social distancing facilities that we're supposed to be doing.
Schools are going back, more people are travelling to workplaces and winter's getting closer. Every community knows they must tread carefully if the virus is to be restrained. Hugh Pym, BBC News.